Hi, I'm Dr. Rylan Hayes, specialist ophthalmologist here on the Sunshine Coast, and I want to talk to you today about pterygiums and pterygium surgery. A pterygium is a fleshy growth on the surface of your eye, usually triggered by long-term sun exposure, even starting in childhood. Given we live on the Sunshine Coast, they are rife here, and Queensland is the capital of the world for pterygiums. They might cause redness of your eye, irritation, soreness, and they can look unsightly. Also, rarely they can contain precancerous changes, which left alone can become something nasty. Furthermore, if they grow big enough, they can affect your vision by directly blocking it or warping the front of your eye and causing significant astigmatism. What can we do about it? Luckily, we have excellent techniques that have been refined over many years, and I've further improved on these with my signature no-stitch pterygium surgery, offered here on the Sunshine Coast. For pterygium surgery, we first remove the pterygium from the surface of the eye and trim it back on the whites of the eye, where it might look red and unsightly. Then, we take a small patch of the healthy whites of the eye from underneath your top eyelid and secure it where the pterygium was growing from. Traditionally, this was done with stitches, which were uncomfortable and lasted for weeks, causing inflammation and soreness. Fortunately, my no-stitch technique uses a biologic tissue glue to secure the graft completely stitch-free. This results in a wonderful cosmetic appearance and a much improved patient experience by reducing the irritation that you might otherwise get from the stitches. The graft heals in place over a period of about a month or two. There are eye drops to use, and the final cosmetic result won't fully be known for about 6 to 8 weeks. However, immediately you'll notice an improvement in the appearance without the pterygium growing on the eye. Pterygium surgery is a day surgery. It's done with an anaesthetist and twilight sedation in an operating theatre. We remove the pterygium, put a patch on your eye, and you leave that on until the next morning, where you take it off at home yourself and start some eye drops. You've got to keep the area clean for a few weeks to prevent infection and let that graft heal in place. So no swimming, no surfing, no getting it dirty or wet for a couple of weeks. As with any eye surgery, there are risks involved. Fortunately, the risk of serious problems from pterygium surgery is incredibly low, less than 1 in 1,000. Common occurrences are some irritation that usually lasts a few days and redness of the eye while it's healing. Recurrence of the pterygium is about 1% in your lifetime. Infection or damage to the vision is fortunately very rare. So if you have a pterygium and it's bothering you with redness, irritation, discomfort, or the cosmetic appearance is not what you want, or it's directly affecting your vision, please make an appointment to come and see me, and we can talk about a bespoke option to improve your life and remove your pterygium. If you're not sure whether a pterygium surgery is right for you, you can find a pterygium symptom quiz on our website. We can get a free estimate of how much the pterygium is affecting your life. Now, obviously, an in-person consult is the only way to get a personalized approach to your care, but this can help give you an idea of whether your pterygium is affecting your life.